actually lead to cancer? Dr. Jayashree?
So as I mentioned earlier, HPV is a very common sexually transmitted infection, and I've also mentioned that in 90% of the cases, the body is capable of getting rid of it. So however, in 10% of the women, it tends to persist, and this persistent HPV infection can further lead to develop it causes some changes which we call it as HPV related early pre-cancerous stages. So, but a very good point is that from this stage also, in 60% of the cases, over 2 to 3 years, the disease, again the immune system is capable of getting rid of even a precancerous stage, and normalcy can be attained. However, if you have all those cofactors that I had mentioned, then it becomes difficult for the body to cure itself. Now, so in the rest of, in a small percentage, only in about 15% of patients with pre-cancer, it can actually lead to a late cancer, and 30 to 70% of the patients with late cancer late pre-cancer can progress to full-blown disease, full-blown cancer. Now, this I want to stress here that you have such a long window from the point of getting infected to developing a full-blown cancer. It's almost about 20 years. So this is the time, it's a window of opportunity. If you undergo regular screening, then doctors can help you detect the pre-cancerous condition and actually can treat you before you develop a full-blown disease. So this is again important. Once again, I wish to reiterate that regular screening is important so that you can be treated appropriately.